Hi, everyone. Dr. Jim Augustine, Doc Talk, September 2021. Hope everybody is staying healthy. We have a lot of activities going on in the country, and a lot of you have gotten a lot busier as this next wave of COVID has swept through most regions of the country at this point. From our starting points in areas, particularly in the Deep South, and then in the little bit in the Midwest, the new wave of COVID is kind of sweeping through. What I have noticed in many of my areas is a big change back to our operations. I think you all need to consider the needs for universal PPE in all patient encounters at this point. Unfortunately, a return to masking in the common areas of the station and when you're together. And unfortunately, that has to even occur with those that have been vaccinated and fully vaccinated at this point. We unfortunately believe that there can still be spread that is asymptomatic amongst people that are vaccinated. The really good news is that spread in the vaccinated patient group is nowhere near what it is in the unvaccinated group. And even amongst our fire people who have had breakthrough infections, which are COVID infections that are in some way symptomatic after vaccination, after full vaccination, those infections are minor, don't result in hospitalization, and result in the person having to take their 10 days off, but has not resulted in further spread. Those are all good points, but still universal PPE, masking when in the station, in the common areas, and in our interactions with the public. So back to education programs, out in the schools, fire prevention activities as we head into Fire Prevention Month next month, all really important. A really critical area for us to be addressing is how busy the hospitals have gotten and the impact on EMS operations backing into first responder operations. So our ability over the summer to try to catch up in the medical system with surgeries and testing and hospitalizations has really caused the hospitals to be busy. Many of them were trying to let their people have a little bit of a break. So we were packing vacations in at the hospital level, trying to get people a little break before what would ordinarily be uptick in hospital volumes in October, November, December. That happens every year in the United States. But this year, starting end of July, August, we began to see the COVID infections coming back in. At the same time, we had a lot of elective patients trying to get the work done that hadn't been able to be done in the last year and a half. The hospitals got very busy. Unfortunately, a lot of them have shortages of key staff members, particularly nursing, and the rapid upslope of COVID patients really challenged them to be able to manage all of the patients. The COVID patients that are coming into the hospital now, somewhere between 85 and 98% are unvaccinated. 85 to 98% unvaccinated patients coming into the hospital. They have a tendency to be younger than the patients that came in a year ago before we had vaccinations. And those younger people, which includes our firefighters, our EMS personnel, our law enforcement personnel, and other unvaccinated members of the public safety world, typically are sick enough in the hospital to require high flow oxygen, aggressive treatment. Unfortunately, some of them die. And we had a death in one of my fire services last week. A very unfortunate circumstance for a gentleman with teenage children. We can't forget the impact on the fire service of the deaths, of the potential long COVIDs, et cetera. And so encouragement again about vaccinations. In the hospitals, those patients that arrive there may be younger, may be able to get out of the hospital a little bit better than the older people who we hospitalized a year ago. Nonetheless, they tie up hospital beds and therefore back into the emergency department in terms of how busy the hospital is, particularly around critical care. And then the ambulances can't offload. The last 2 weeks, a lot of national discussions, national webinars about how to keep your EMS system running when the hospitals are full. Really important that every agency address that and work as cooperatively as possible with the hospitals to make sure that all patients, COVID or non-COVID, hip fractures and seasonal injuries, et cetera, are getting outstanding care, both pre-hospital into the emergency department and into the hospital if needed. That we do the right messaging to our community when we are busy to make sure that the community understands that the emergency system is working at maximum capacities in many cases, and that going into the hospital, again, will involve people not being able to see their family members because of the limited visitation policies. And in many cases, people don't want to be in the hospital because of the many COVID patients that are there. That all comes back to us, even in terms of fire engines and first responders sitting on the scene, waiting for an ambulance to free up from a hospital to come and transport the patient that is in front of us. It comes back to the 911 centers and their ability to say a piece of equipment, including a piece of equipment, will be on the scene at your house in X number of minutes. In some cases, the 911 centers have had to do education to patients about delay in ambulance arrivals. All of those impact our operations out in the field. Really important to us is what's going on with the members, and members getting sick, members having to be on quarantine because of high-level exposures. Also impacts how many hours our members are putting in. And it is a stressful time again in the service. We wanted to get to the beginning of fall here in good shape, with people rested and having taken vacation and ready for fall activities. But in many cases, it is a lot of overtime hours and a lot of stress on our crews. So I ask you, please take care of yourself. If not vaccinated yet, please consider vaccination. Please get your family vaccinated, if possible, to protect you. And at this point, to protect the younger people in your household. The good news of the week is the FDA is likely to look at emergency use authorization for children age 5 to 12 in the next 3 to 4 weeks. That puts us in the early part of October with the potential the vaccines will be approved down to age 5 to 12. That would allow us to get our grade school aged children vaccinated and protected in their environment, protecting the hospital staff at the same time, and allowing us over time to not have the kids in masks as they go to school. In addition, with the beginning of school, the kids have been exposed to a lot of other respiratory bugs. Remember, the kids have been away from each other for a long time. Even in my household where grandkids are present, RSV came visiting. Respiratory syncytial virus is the regular seasonal respiratory bug that affects children, not so much adults, and can really, for very young children, make them very sick. So I had a 9-month-old grandson who was just miserable for 2 weeks and couldn't sleep and couldn't do his activities, which limited his parents' abilities to do their work. He happened to give it to his sister, who is school-aged, who then had to miss school. In some cases, those 9-month-old and other age children have had to be hospitalized in the children's hospitals. So when you hear about the children's hospitals being busy, it's not just about COVID busy, but it's about the other respiratory bugs that the kids are spreading to each other. We do not have a vaccine as yet for RSV for kids, but hopefully in the next month, we will see the first authorized use of the Pfizer vaccine, in particular for age 5 to 12. You will know now that a couple more vaccines are in the approval process. Those are from AstraZeneca and Novartis. And in a couple of weeks, we'll probably share information about getting up to 5 available vaccines, either under emergency use authorization or full approval. All good news. because the way that we're going to get out of this pandemic is high levels of vaccinations. And unfortunately, the natural immunization that comes from people who have gotten sick with the virus. For this week, take care of yourselves, take care of your families, take care of your departments, take care of your communities. All really important messages. We're back together again. We're probably in masks in common settings. We're still washing our hands. We're still not coming to work sick. We're still not coughing or sneezing around other people. In about 3 weeks, we'll be talking about allergies across most of the country and have to talk about what to do when you have allergy problems. You're not sick, and with the allergies, you want to get on the right medicine to be able to go back to work. All very important things in the fire service. Next month's also Fire Prevention Month. Typically, we're out with the kids in the schools talking fire prevention, which is really important as lifelong lessons for the kids. We hope to be able to do that safely. In the meantime, take care of yourself. Our responsibility is to get you to a healthy retirement. Please take care, stay safe, be happy. Thank you.